Hi there. Today we're going to continue our urinary infection talk, and we're going to go upstream to the kidneys. We're talking about pyelonephritis or kidney infection. What happens here is that a bladder infection, also known as cystitis, ascends the ureters into the kidneys, and this is much more serious than a bladder infection and can make you much sicker. Some of the risk factors for pyelonephritis are recent broad-spectrum antibiotic use, history of infection with resistant bacteria, or healthcare exposures. When someone presents with what we think might be pyelonephritis, generally the symptoms we're going to see are flank pain, meaning along the sides, CVA or costovertebral angle tenderness in the back, right about here, fever, sometimes vomiting, and people just feel sick. Bad sick. As with any urinary concern in men, we have to consider that the prostate might be involved. We're not going to address that specifically today. It might present in different ways in special populations, such as those with spinal cord injuries or other underlying diseases, so having a high index of suspicion is important. It can also present with bacteremia, which is bacteria in the blood, sepsis, which is symptoms that involve your whole body and can lead to shock. We can see multi-system organ dysfunction, certainly kidney dysfunction. They're not filtering as well when they're diseased, and can also lead to acute kidney injury. Like I said before, bad sick. When we're working up somebody who has a suspected kidney infection, we also need to consider pelvic inflammatory disease in women who are sexually active and may be at risk. Also, we want to run a urine culture because we have a certain set of antibiotics that we normally choose for urinary infections, but if there's a concern of a resistant bacteria, we want to make sure that we have that specimen before antibiotics are initiated so that we can get some meaningful data that will help us choose a different antibiotic if you're not improving as expected. Also, if you aren't improving as expected after you've been on antibiotics for a few days, we may need to get a CT scan to see if there's a kidney stone that may have caused the infection to begin with. When we have our diagnosis, prompt antibiotic initiation is important to get all of these symptoms under control and to prevent hospitalization. If the patient is very sick and throwing up, not able to hold down their antibiotics, they may need hospitalization for a few days just to get that under control. Significant pain can accompany this, sometimes very similar to that we would see with kidney stones because of the inflammation in the tissue surrounding the kidneys.
Write that down, write that down!
If you do get hospitalized, they're going to want to give you plenty of IV fluids to make sure that they keep your body, but also your kidneys especially, well hydrated and filtering out the bad stuff. They may run blood cultures to see if it has gotten into your whole system. Usual antibiotic course is 7 to 10 days, but that may need to persist longer depending on your case. If things just aren't clearing up as expected, we may need to have some more workup, possibly by a urologist, to see if you could have some structural abnormalities. Once you have all the information, have the right antibiotic suited to the bacteria that is causing this infection, you should be well on your way to recovery. Stay tuned. My next segment, I'll talk about recurrent UTIs and strategies to help prevent. Don't forget to like and subscribe.